Good evening. I'd like to call to order notice of the joint meeting of the Health and Human Development Committee and the Human Service Board for Monday, June 22nd, 2026. It is 5:02 p.m. and we are in the Ives Grove chambers this evening. I have the attendance here, so I'm going to move on to number 2 is the chairman's comments. I have a general comment, and it is, let's go Brewers. Let's do it with our payroll, much unlike the payroll on the West Coast, if we know what I mean. Okay. Could I have Youth and Governance read the statement this evening, please?
Hello, we are members of the Racine County Youth and Governance Program, and we will be participating in tonight's meeting. This program serves to empower youth in Racine County by encouraging us to participate in local government. We have agreed to abide by the applicable standards of conduct that will govern any elected county board member. While we are encouraged to participate and are allowed to have a non-binding advisory vote on matters before the committee, all formal action taken by this committee will be based solely on the binding votes made by county board supervisors. Thank you.
Thank you, Tria. Let me get my notes here. What did I do? Okay, next up, I am looking for the committee for approval of the minutes from July 13, 2026 for the Human Services 2027 Budget Plan Public Hearing. Do I hear a motion?
I so move. Second.
I have a first and a second. Thank you. I have a first and a second. Discussion on this? Hearing none. Youth and Governance, all in favor?
Aye.
Committee, all in favor?
Aye.
Any nays? Hearing none. The minutes from the July 13th, 2026 Human Services 2027 Budget Planning Hearing are approved. Next up, I have the approval of the minutes from July 13, 2026 for the joint meeting of the Health and Human Development Committee and the Human Services Board. I need a motion.
Second.
I have a first and a second. I need another board member for approval. Brenda. Thank you, Brenda. Any discussion in regards to those minutes? Hearing none, let's take a vote from the Health and Human Development Committee. All in favor?
Aye.
Opposed? Hearing none. Youth and Governance, all in favor?
Aye.
Approved. Now, a vote from the Human Services Board, all in favor? Any opposed? Hearing none. The minutes are approved by the board also. I'm moving on to number 6 this evening. We have Wood County Resolution 26-6-1, support for sustainable state funding for local public health departments. This is for information only. I believe our county has something similar to this. Could you just touch base on it, Hope,
Yes.
of what it is? Thank you.
Yeah, let me bring this close to me here. So we are working with Corporation Counsel to prepare a resolution for the county board to do similar to Wood County. As you know, often other counties will initiate this and then it's shared with other communities to do the same to show kind of solidarity regarding the lack of state funding regarding particular departments or programs. And I like to use a quote that WCA had told us about the state's tendency when it comes to federal funds and passing on to local communities. They said that they can sometimes have sticky fingers when it comes to giving allocations to our local departments to carry out the work. And I think COVID really showed us that with the health departments that were responsible for being in the trenches and doing the work, whereas the state subsequently built capacity on their end and has done very little passing that money on to the local communities. This is obviously mirrored in other areas, but I think it's particularly important in the prevention area for public health to not make us be in a constant state of perpetual grant writing and competitive grants. And Jeff and his team are amazing at writing and securing grants for us, but that shouldn't be the way that we have sustainable funding to manage our operations. So that's the high level explanation of this. We will be preparing a resolution for the board, and the September meeting, if it's okay with the chairman and vice chairman, Jeff will be facilitating that meeting and covering this topic along with a few other things from public health.
Thank you for that sky-high view on it. And it's my understanding when we get enough support from different counties, this then is brought to WCA, and WCA makes it a priority and lobbies for it at a state level, correct?
Right, exactly.
Okay, thank you, thank you. Let me move on to number 7, which is very pretty much the same. It is Clark, Greene, and Monroe counties resolutions numbers 21-7-26, July 1, 2026, July 26, July 1 of 2026, supporting sustainable state funding for local public health departments. Again, information only. Again, very much the same as the prior one from Wood County. Okay. Any questions from the committee or the board in regards to these two information only from these separate counties? Again, this is information only, so I will move on to agenda item 8. Implementation of mental health symposium and transfer $3,000 from the opioid settlement fund. Information only. I believe this was brought in front of the finance committee last week, I think it was. And could you explain the purpose of this, the meeting, and where it is being held?
And
Should it be approved?
yeah, absolutely. And in further assessment of the agenda, I probably should have put item number 12 above these because we are going to do an overview of what we did for the full county board to give the explanation of why 8, 9, and 10 are on there. So if it's okay with you, Mr. Chairman, if we could take that agenda item first.
Which one would you like first?
12.
Great. Let me then address the opioid task force / substance abuse presentation by Dr. Galbus Rieg.
Yes, Reed.
Reed.
So he, as you know, is unable to attend today. So we are going to be moving him to the November agenda. So he had an unavoidable conflict, but you have the lovely Yelena Jones and me here to just give a condensed overview of what we presented to the board, and then maybe just have some dialogue regarding these items in a little bit more detail if you have any specific questions, or we can obviously address them through the information only items too of what our initial requests are with those opioid funds.
Great. Yelena, nice to see you. I'd like you to speak a little bit about that then.
Are we can just walk through the PowerPoint.
Yes, could you?
I think that would be easier. You can pull it up too. Either way is fine. I had it printed out, so we didn't necessarily have to, but
Yeah. We're doing good on time.
okay.
Yep.
Okay.
Thank you.
You can move to the next slide. So just as a reminder of the Opioid Advisory Council, that was established back in October of 24 under then County Executive Tom Rohnhaus. And I have chaired that council meeting or those council meetings for about 18 months. And the goal of that was to establish a multidisciplinary team for guidance about what broader community needs exist beyond just like what we see from county government and in particular social services. And I believe on the handout that I gave everybody before, it has the list of members that were on there, but essentially it was fire, EMS, and law enforcement, as well as representatives from the hospital system, elected officials, in schools. So we had pretty diverse representation on there. And the goal was to give us guidance of where we should be putting our investments rather than funding municipalities or other areas. I think that was a little bit of a misnomer from the start, but help to inform, like, it's, the settlement dollars were coming to us because we were an impacted county, and each municipality was eligible for applying for them on their own. But we do care about all the other systems that are helping to serve individuals with substance abuse issues related to opioids. So one of the things that we focused on from there, moving on, sorry. This is a reminder of what the opioid settlement is, and that local governments would be getting the funds directly. So moving on to the next slide. I kind of already went through that too, sorry. So the recommendations, again, were to guide us on how the allocations should be spent versus, again, giving to the municipalities. Next slide. So the recommendations framework, we basically go through these steps. And then if you were to answer no to any pieces of this, then we would not prioritize that or bring it forth to the county board for consideration. Because we need to make sure that it's aligned with the opioid settlement guidelines. It's not eligible to be used on anything. There has to be a close nexus to opioid abuse. It can't be any addiction. There has to be primary consideration of it being opioids. And does it have a documented gap or unmet need, which that part's usually a little easier to come by. There's a lot of unmet needs in our community, but again, it has to be tied directly to that opioid nexus. And then does it improve coordination or continue to add to fragmentation? And there's several examples that you could see of that, but when there isn't integrated care and it's adding into siloed aspects rather than coordinating law enforcement and behavioral health systems and hospitals, we don't want to further perpetuate those silos. And then is it either evidence-based or evidence-informed, because we want to have some guidance that there's actual effectiveness in these investments. And ultimately, the biggest takeaway from this is that the county board gets the final authorization and say for how the funds go. This is just for us to make sure that those boxes are checked before you would ever consider anything. And then moving on. So I'll let Yelena talk a little bit more about how our crew program, which is the County of Racine Essential Workers or Emergency Workers, you could probably use it synonymously, how we're integrating in substance abuse follow-up with our crew team. And go ahead.
Perfect. So like Hope said, our crew team has been established since about 2020. What we're always doing is responding. We're trying to intervene early and often to ensure that individuals aren't having endless contact with law enforcement when it really is a mental health or substance abuse issue. We were able, I know we talked about the iPads being divvied out probably about 6 months ago. So we're able to provide those telehealth services throughout the county at this given time. And we'll get to how that kind of helps our day-to-day process. And then our next step now that we're going to speak about is our real-time overdose tracking. You can go to the next one. So our crew objectives, obviously, it was to promote early and often collaboration and communication between HSD and the law enforcement agencies to ensure that we're able to intervene before the crisis emerges further, try to avoid unnecessary hospitalizations, ensure there's like a continuity of care throughout the county, no matter where you're located within the county. And then now what we're trying to incorporate in this is an overdose response. We obviously all are aware of the opioid epidemic and trying to promote that early engagement and intervention with those individuals that are dealing with some substance abuse issues. So crew intervenes when residents are obviously at their most vulnerable. This is across the spectrum from mental health to SUD issues. It's consistent in making sure that we're offering resources when they're really truly needed. So for crew, the law enforcement behavioral health, when we were able to kick that off, the one thing now, obviously, we're able to incorporate the mental health aspect of things. They're able to contact us with law enforcement present, excuse me, and complete an assessment. The same will be with the SUD portion. If someone doesn't want to interact with us at this given time, we know following an overdose, it's unlikely that someone's going to be in the state of mind of wanting to talk to us at that given moment. So normally that law enforcement officer or EMS responder would make a referral to us, and then crisis, our crew workers would be responding within 24 to 72 hours.
And just to elaborate a little bit on that, this is where we talk about fragmented systems versus improved collaboration and integrating in our two disciplines. We work very closely with Lieutenant Massey, who is a Phoenix expert and is really good at helping to design tracking systems and be able to tweak things to be able to collect information better and to meet the needs of all the different partners. So he has been working with Phoenix at developing an overdose modules that we would then be triggered these referrals, as Yelena says. So we're just waiting on the technical assistance from them to be able to give them the go ahead. But otherwise, we would have no formal way to be tracking any overdose and notification from our partners. It'd just be them giving us a card and hoping that they follow through. So this helps us to have some accountability for that.
Well, and I think to Hope's point, when discussing how referrals come in throughout the county, obviously law enforcement is using Pro Phoenix. Some EMS services are using different technology. So all those referrals are not coming through. So we're not notified of who's overdosing, where it's occurring yet, and then we're unable to provide that necessary follow-up. All right. So kind of what we were discussing right now and trying to figure out how do we collect data? How do we, make sure that we're kind of tracking the progress on the overdoses, how we're able to incorporate and get the services out to the consumers that live within the county, and making sure that everyone has access to the services that they need. And the biggest thing for us is making sure that community members are aware of the services that are available throughout the county.
Excuse me, Yelena, I have a question. You talked about tracking, and there is some tracking that we cannot obtain, correct?
Well, with Lieutenant Massey, as Hope discussed, we're working with the Pro Phoenix creators to make sure that they're able, we've created, or should I say Lieutenant Massey has created different check boxes that they're unable to get past without checking. So if they were responding to an overdose, they would have to indicate that. If Narcan was dispensed, they would have to indicate that as well. And then on the back end, it would automatically send us a report every morning, letting us know where those overdoses occurred, their contact information, and then our peer support team and our crew team would go ahead and respond within 24 to 72 hours to offer services, to offer more Narcan, to offer the, assistance of peer support.
Thank you for that follow-up. And sorry about the interruption.
No, you're fine. So we were in the planning phase for some time now. We obviously during this, we were trying to figure out what overdose data are we currently collecting, identifying the resources that are available, and making sure that we're implementing a follow-up service procedure for our crew staff. And then obviously developing different training protocols for our staff. Our implementation prep consisted of making sure that we're holding different prevention training sessions for our staff, some community partners. We've done this through our crew meetings. We have quarterly crew meetings with all the law enforcement municipalities are invited. We usually see one department head come to these meetings, and it includes our H&SD team to discuss the different issues, mental health or SUD wise, that we're seeing throughout the county, discussing, barriers to, if it's access to services, hospital systems, individuals going to jail, whatever it may be, we're discussing here. So it's really a platform for us to be able to bring those issues forth. We have been able to establish a crew referral email. We will also implement that, as Hope said, until Lieutenant Massey is able to work this out with Pro Phoenix. On the back end, what we'll be doing is receiving referrals that way via this email. That way we can initiate our team going out and responding to these calls. And then obviously right now we're at our service launch, and we're hopeful that the peer support individual that we're requesting will be approved.
And do you want to just talk about, because it'll be coming up as an item, why peer support is an important part of the overdose response?
So when someone's struggling with SUD issues, sorry, substance use treatment issues, they really need somebody to guide them along their support. Typically, an individual cycles between 7 or 8 times before they're able to sustain a level of sobriety. So we know with that, it can be very challenging financially. Usually, they're unable to hold jobs. They're struggling to even get in services. Sometimes they've cut family ties, or people have put up barriers of not wanting to interact with them because obviously they're um,
Mhm.
endless issues of cycling through the system and with the struggles that they're dealing with substance abuse. That peer support really comes alongside them to guide them through the treatment, the support, whatever their needs may be. It may be, looking for a job, trying to find housing because they've been homeless. And we know when your basic needs aren't being met, it's very unlikely that you're going to truthfully engage into treatment and be able to give your whole self forth in trying to engage in those services. So a peer support for us right now, we currently have 2 peer supports through our SOAR grant, and that's our state opioid response grant. Obviously, those positions are maxed out with the number of consumers that they're able to serve. In order to pull off this initiative, we really need additional peer support.
Awesome. All right.
Thank you, Yelena. Questions? First of all, from the committee. Now from the board, Supervisor Shakur, thank you.
Thank you, Mr. Chair. Just a quick question, and what I'd like to know, and I know that that the Racine County Human Services is doing an excellent job on all levels as far as opioids and family issues and stuff like that. I'd just like to know, is there something on a collaborative basis that's dealing with the behavioral health and doing some upfront planning as far as opioids and stuff? Why are people going to opioids? Is it the family breakdown? Is it
Mm.
the relationships, without a job, homeless, whatever it
Mhm.
is? Is there any way that we can
Mhm.
expand
Mhm.
there to make sure that we avoid some of these things? Because you know, and I know, and we all know that it costs hundreds of thousands of dollars and millions of dollars
Yeah.
once a person gets into this situation. And
Yeah. So public health is involved from that prevention standpoint and being able to help develop effective education and messaging regarding avoiding any sort of addiction issues in the first place. We do provide our education for prescribers, helping understand that that's often a gateway into opioid addiction in particular. But in terms of all of the science behind addiction, that's why we asked Dr. Galbus to join us, and he will be here in November, and he will be an invaluable resource to be able to have some of those question and answer type things about addiction, because he's one of the region's top specialists in that area to be able to talk about the whys behind it. I think he's probably best positioned to answer some of that. But we are approaching it from a very high level view, from public health and prevention all the way to treatment intervention, and even from the overdose fatality review team for what can we learn from those who, succumb to the illness. Yeah. Oh,
it's a
absolutely.
good opportunity, but I know it's tough. There's a
Yeah.
lot of stuff going on that is tough.
Thank you, Supervisor Shakur. Thank you so much. Supervisor Coleman? No.
Well, I was just wondering, so we were talking about with the prevention and all those type of things. So are we gonna get something in place that helps with the housing situation, being homeless and all that? Are we gonna do something about that? Furthermore,
Mhm.
I know that with our mental health building open up, I know that we're gonna have 15 beds, correct?
15 for behavioral health,
For behavioral
for
health, okay.
crisis stabilization, and then 15 for
Okay,
substance
because we
use.
have to
Yep.
know that sometimes mental health and opioid abuse, they all go hand in hand.
Yes, absolutely.
Okay, so training
Mhm.
as far as police officers, being able to know if a person is having
Mhm.
uh, a crisis,
Mhm.
a medical mental crisis,
Sure.
psychosis, sorry,
Mhm. Yeah.
or is it drug related?
Mhm.
what are we gonna do for Racine
Mhm.
so that we are more clear of what you're dealing with?
Mhm.
Because it's crazy to have people in jail when it's really like mental health
Mhm.
or substance abuse or things like that. Being able to know the difference for our officers to be able to be aware to detect what is what.
Mhm.
So what are we going to do about that?
Sure. Go ahead, Alana. You can.
So I think the biggest thing for us during our crew meetings, we're discussing this endlessly of having the capability to do direct drop-offs to our sale program. There will be a police entrance there. So if they're struggling to identify what is going on, they're able to bring that individual to sale. We will assess the situation. If they require further medical clearance or intervention, obviously we can drive them to the hospital. With this, what we're really trying to do is create like a collaborative effort with working with law enforcement and really encouraging the contact of crew / our crisis line to say, hey, can you guys come out and assess, versus the law enforcement officer being stuck. That was initially the co-response model that we were reviewing, was to make sure, I know we didn't take the embedded approach, but we took the co-response approach where we're able to meet those individuals, law enforcement officers, wherever they're at in the community. We added the virtual option as well to ensure that a crisis worker is always available. So if they think there's something mental health going on, they're contacting us. I will add that we work very closely with the county jail as well. If someone is appearing to have some type of mental health crisis that exceeds the capability of what Racine County Jail is able to meet, their mental health team there, they are contacting crisis and saying, hey, we need you guys to come out and figure out, next steps of what we're able to do. So it's endless amounts of advocating, trying to collaborate with community partners, and continue to just kind of advocate the mental health needs and what resources are available within the county.
Okay. One more.
Yeah,
Okay.
and I want to expand on you go first.
Okay.
Yeah.
That just leads me back to the emergency room.
Mhm.
I'll never forget a year and a half ago when the question was posed, who gets it confused the most
Mhm.
and who ends up calling the police, and it was the emergency room. I'll never forget that. How are we looking on that now? Has that got better? With the sale program and implementing, how are those numbers looking?
It's the 911 dispatch data.
Yeah.
You remember? Yeah. Okay.
Yeah.
So I think for the most part right now, we've worked closely with a hospital leadership team to ensure that they know how to access us. We know when new social workers start in the ER, we're offering up them coming to the H&SD building to basically tour sale, give them an overview of the resources that we're able to offer. I will say that I feel like we've strengthened that relationship to ensure that they're aware of who they can access. I think sometimes with the emergency department, what's difficult is a decision made by law enforcement to take somebody into custody supersedes our decision. So we don't have control over that. All the best we can do at that point in time is advocate. Under our crisis certification, the biggest thing for us is making sure that if someone's in a mental health crisis, that we're appropriately advocating from our lens, the concerns, the needs of that individual, and what we believe would be the best course of action. But again, if law enforcement is involved, sometimes they kind of override our decision.
And I just wanted to explain the difference between embedded and co-response that we have, and the reason we chose to go with the co-response model of joint response. Uh, if we were to embed our social workers with all the different municipalities, I believe we have 8 or 9 different jurisdictions, and not all have the same level of need, right? So like the city, Mount Pleasant, Burlington, Caledonia, some of our higher calls for service. But that we'd have to be standing up an employee in all those different areas, managing them from different locations. And one of the things that starts to happen is, there's a little bit of, I guess, scope creep of what an expert is doing because you're more into their operations. So if law enforcement were to come and work in social services, they naturally are going to start to become more of our culture, where it's not honoring the distinctions between the two areas. There's value to it, obviously, in bigger communities where the jurisdictions are much larger. The sheriff's office covers a further area, but for financial reasons and also some of the aspects of that, we chose to go with that co-response model, which there are hiccups on, right? Because it's based on their referrals to us. We're not part of their system. So there's a cost benefit for either model.
Thank you. Thank you very much. I just want to, for the record, go back to number 8. We did address the mental health symposium and transfer of $3,000. If it approved, the approximate date and time and location of that symposium, I believe, is October, is it?
October 7th,
Okay.
the starting time, I don't remember.
Uh,
9 a.m.
8:30 if you want coffee.
Okay.
At
so
Roma?
8:30
Is it at
At Roma, yes,
Okay.
exactly.
Great. Okay.
Yep.
For the record, and we did cover the creation of one FTE contracted peer support specialist effective 9/30/2026 to 12/31 of 27, and the transfer of 95,068 funds from the opioid settlement fund budget of 2026. Thank you. We addressed that. And I don't think we addressed the request to accept the Community Health Services Block Grant.
Nope.
If you could just touch on that briefly, please.
You get your papers. All right.
Absolutely. So
Okay.
Yelena wrote another grant to the topic earlier about public health having to chase, money through grants. And she got it.
Yes. So the Community Mental Health Services Block Grant, we already receive about $963,000 per year that covers some of our adult family home costs. This was an additional block grant that came out. There was a focus on housing regarding individuals that are dealing with serious mental health illness, who are experiencing homelessness or are at risk of homelessness. So our team came together and basically discussed how we were able to quickly initiate spending this money and utilizing the funds that were available. The funds became available at the end of July. The grant was due, I want to say, by the end of July 30th. They came out with their decision as of the first week of August. The funds total $200,000, $200,976. The funds need to be spent by 9/30 in entirety of this year. So I will make that very clear. Yes. So we were really going for it. But we came up with a good plan of how we were able to do this. The one thing that we know through all the advocacy talk that we've had here tonight is really promoting the services that are available within the Racine County for mental health, for SUD services. So we were able to ask for $100,000 of this grant to go towards advertising of those billboards, pushing out different informational stuff, which obviously public health helps us out with a lot. The remaining of the $100,976, we will work with a local nonprofit agency that deals with helping individuals that are homeless. We cannot pay for shelter specifically or rent specifically. However, we're able to engage housing navigation, crisis stabilization, community-based supports for improving the outcomes for this population. So we were able to write this grant. We were able to be approved. We were able to tie this into our current sale program for individuals that are circling in and out of sale that we know may be dealing with mental health issues, but some of the root of their issues is dealing with homelessness and not being able to meet their basic needs. So as soon as we're able, hopefully, to get this approved, we're able to move through those discussions with those individuals very quickly. The advertising obviously will not be a problem because things cost a lot nowadays. But we have a plan, and we've been having conversations behind the scenes of how to get things moving and how to make sure that the resources are available to residents of Racine County.
Is food on that list?
It is not. I know, that's
But
expensive too.
our primary homeless shelter in the
It
area we're
is.
hoping to support.
Okay,
Yes.
great. Okay, we addressed 10 and 11, and I'm going to jump down to 12. We know the doctor will be here in November.
Mhm.
On 13, opioid and overdose update. Hope?
We do not have one today, partially because we're going to be talking about that with Dr. Galbus, but also we were unable to get our request from the City Health Department in time, and we had some other people out of the office. So we don't have an update for you today.
Next month, we will
Yes,
put that on the
absolutely.
agenda.
And we will have both this month and next month on there.
In one of the not most important, but always on everybody's mind, Yelena, Meals on Wheels. How are we doing?
Go ahead. That's okay. Basically, we got the supplemental amount from Guar, and so there isn't a waiting list. However, we have to notify people that they would be on a waiting list for not the allocation we got in order for us to receive the funds. So we will be telling people that call, you're on a waiting list, but good news, you're off of it.
Yes.
So it's just a little bit of a workaround.
And
in
we're in
case-
the process of doing that,
Yes,
correct?
yes.
Great,
Mhm.
great. Any questions from the committee?
I hit this one or not?
Any comments from the committee?
Residential.
Oh,
How about the board? Any questions from the board? Any comments from the board? Great.
Yeah.
Any other comments from Hope or Yelena?
yeah, there was 11. There's another grant.
Oh, yes, yes, right.
Sorry.
Request to accept substance use prevention, treatment and recovery services block grant.
And Yelena's really
Award,
excited about this.
information only. Yes.
I am.
Thank you.
I have to say this
Mm.
one. So this one was the substance abuse block grant. These are dollars that we already received. We utilize them for treatment. These were additional funds. Again, same timeline, need to be spent by the end of September 30th. This total came out to 166,724. I am happy to announce that we wrote this to fund all our needs for the new residential, and we were approved for it. So this will be all the supplies, all the medical needs, all the bedding, locks, anything that we need to secure folks' stuff. So we are very happy about that.
Good job.
Congratulations on accomplishing that.
Thank you.
Wonderful. Okay, correspondence and other business. Hearing none. Next meeting, September 14th, 2026, Ive Grove Complex Auditorium. I need a motion to adjourn.
So move.
We are adjourned. Thank you.
We did it.
roll here. All right, I'd like to call the committee of the whole meeting to order. If you could have a call or attendance, okay. Item number 1 is discussion regarding the 2027 bonding and debt service levels. Did you put up the screen? So everybody should recognize this. It's called the Bob Miller graph. Supervisor Miller. This is the graph that's on page 398 of our budget for 2026. And this shows the debt service that we have over the next 20 years. As you see, it's kind of an uphill because of the bonding we've done for the law enforcement center, the marina, and the mental behavioral health. So it goes up a little bit, and then it goes down as we pay things off. So just keep that in mind while we talk about this. Now, that does not include the Foxconn bonding, because that's taken from a special assessment. So it doesn't hit the levy. So this is what the levy is. So roughly in 2027, we're going to have about 10 million in 2028, plus whatever we add for the 26 budget. So if you want to bring up the next slide. So this is what the debt service, when you have different levels of interest rates. 4, 5, and 6, that's how much in $1 million adds to the levy. So with $10 million, if you had at an average of 4%, that's, $740,000. So to keep that in mind too when we're talking about the debt service. Now, I've talked to a few people that have taken a real deep look at this, and they're looking at somewhere between 14 to 16 million dollars of debt service. Now, we're not going to talk about specific projects tonight. I just want to hear your thoughts on that. And also, you have to realize that most of our bonding now is going to be at 4% or better. We have some lower ones that'll be at 2 and 2.5 that are going to be paid off, but we're going to be replacing them with 4. So that's going to make 4 or 5. That's going to make our debt service go up just by that criteria. You also have to kind of remember that somewhere down the line, if bonding or refinancing gets down back to the 3%, we can rebond some of these at a lower rate. So that would save the taxpayers some money. So I'll give you my thoughts on bonding. Now, we have somewhere about $23-24 million of requests in the capital area this year. When you're talking about capital and bonding, we have to realize that, there's different theories out there. Some municipalities will go the whole hog because the pressures on a small municipality can go that far. We have a bonding that I don't think anybody in this room would want to go all the way to 5% of our equalized value. That would be a disaster on the tax bills. If you recall the conversation we had back a couple months ago about tax and levy, we were looking at the rate of growth and to CPI. Now, they've got some preliminary numbers on net new construction, and that's about 5%, which is real good. And that's the driving factor, of course, is Mount Pleasant, and they're around 16. So, that you can, unless the economy really takes a tank, we have to also consider that. So when we put together a budget, or when the staff and the county executive put together a budget, it's kind of a puzzle. You take a look back at the first one, you got to make sure that you're not got that big bump like this, or you go up a level and come across. So I'd like to hear some thoughts on bonding. I don't know. Does anybody want to start? There's no thoughts? Supervisor Osterman.
Thank you, Mr. Chairman. I guess I'll ask a couple of questions. We know that our bond rating changes that percentage periodically, does it not? Double A versus triple A?
Yeah, I think we're we're at the highest rating right now.
At triple A?
That's
No.
double A, excuse me. Yeah, double A.
So that's what I'm curious about. I know Kenosha is triple A. What does that, in a general sense, for planning purposes, change the percentage? How much does that typically change the percentage, and how often would that occur?
Director
Is that something?
Director Zimmer. Okay.
I have a comment on that, Supervisor Osterman.
Supervisor Trotter.
There's a variety. I'm sorry, Mr. Chairman.
Go ahead.
I'm looking
Thank
for
you.
some education here.
Yeah, it's not only one factor. There's a lot of different factors that are put into AA and AAA ratings. And one of the major factors is income for the counties. Okay, that is a major factor. And the income for Racine County is different than that of Kenosha County, which may be one of the things that gave them a AAA rating. I'll let Director Zimmer continue on this.
I'm talking kind of like in a general sense
Mhm.
here, what, the differences, how much does it make a difference?
So we rate with S&P. There's two sections that create our rating: an institutional framework, which every Wisconsin municipality is given the same rating, and then individual credit profile, which is 10% of our economy, 10% of financial performance, how we perform to our budget, 10% to our reserves and liquidity, 10% to management, meaning staff and elected officials, and then 10% to our debt and liabilities. We basically, our financial advisors have reported back to county board leadership and to the county executive that there isn't really anything more that we personally can do to move the needle. It's the economy of this area, and it's the personal income of the residents of Racine County. So we had them run an analysis of how much would it cost us if we went down a grade or save us if we went up a grade. They estimate $50,000 per 10 million of borrowing. So it's not significant in comparison. It's obviously something we want to strive for, but it's not the end of the world if we go down or if we go up.
You said 50,000 per 10 million?
Yes. And they noted
Over the span of
a 20-year debt.
20 years, okay.
They noted that upgrades in our rating would require material improvement in our economic measures and in the state debt metrics. So if the rest of Wisconsin increased in their metrics, then we would benefit from that, but there's nothing that we can do about it.
Okay.
And if I may, Chairman, I just wanted to
Go ahead.
note that you statutorily, we are limited to 5% of our equalized value, but this body adopted a debt management policy earlier this year where we self-limited ourselves. I believe it's 3%. 3% of our equalized value, which is 27 billion, so 3% of that.
Any further comments on bonding? Nobody? Supervisor Rossi, nothing to say? All right.
Is there a particular question you'd like to hear?
Well, I guess that's kind of, well, well, I guess what the level is. I mean, uh, we got, I mean, it's part of the levy. Like we had the levy discussion. It was really good levy discussion. I know we have some supervisors that want to build a lot more roads than we have, and that's kind of where we have to go now with the next step. We put together a 5-year plan and also a long-range plan for roads. We also have to fit in the capital equipment, that snow plows and larger equipment at Public Works. We also have to have, some of building upgrades here. So it's, that's kind of the question. How far do we go? Do we, and we let the staff and the county executive present, a budget that has what they feel is bonding, but I don't want to have, the lengthy discussions about, what we need to bond and, and how much we need to bond. If we give them a general idea of what we feel bonding levels are, they can kind of work with the county board here. Versus, if we have, some supervisors want to spend more money or less money. Then let's start with the $15 million. Is that acceptable? Now we spent two last, $2 million. That's not that we added a couple meetings ago. Is that $2 million count towards the 15 million, or is that $2 million that we added and we're going to go to 17? That's kind of the Supervisor Osterman.
So one thing, I've never felt like it's that black and white. 15 million is okay, 15.5 is too much. I think there's plenty of other factors in play, and one of them could very well be the economic impact of those projects and initiatives. There may be a way to discover what those economic impacts would be from those types of projects. Maybe analytics could help us with that, to maybe make that borrowing more palatable when it's necessary. You may run into a project that, for whatever reason, has the potential to increase county sales tax revenue or what have you, anything like that that may offset the negative effects of that debt. So that would be something that I would I think I'd be interested in finding out,
You're talking,
as one suggestion.
so something like the break wall down at the lakefront. That would be something that would have an economic impact.
I'm glad you mentioned that because we need to talk about that. Yeah, something like that.
Supervisor Horth.
Thank you, Mr. Chairman. I think that I'm just, in my mind, I'm trying to think about exactly what the requests from the various departments is going to look like. And granted, I understand there's wish lists and obviously that has to be given consideration. But I guess I'm looking at, and PWC is an example. I mean, I know there was a very large number. And to me, having now had the opportunity not only to be on the committee, but to walk the entire facility, I have a great degree of belief that what is being requested is not unreasonable. But at the same time, I understand it may not be practical at this time. So then I take a look at what I think you may have started out with, and it might be on, I think it was page 395 in the budget. All right, so what is the 3, 5, 10-year plan to get all of these things addressed? And to me, that's where I'd probably be my starting point on what the bonding would look like.
And that's exactly what you guys, the Committee on Public Works is doing. Now there's some some things like that are easy. It's not easy, but it's easier.
Matter of opinion, but I understand what you mean.
You know, I mean, we know that this bridge needs to be fixed, that road needs to be fixed, and that piece of equipment is well past its retirement. You know, so that kind of, you know, is part of the equation. And that's where the planning that you guys on Public Works did is very fruitful. Now, some things, you know, facilities is another one, and that's exactly another area that you get that committee needs to work with. You know, and you know, when an air conditioner goes out and it's 95, you're gonna fix it. Or you're gonna have to find money to replace it.
Hmm.
You know, if we get and we're gonna be working on that. Staff is gonna be working on that to get a replacement schedule together.
And,
know.
and to me, that becomes, if I may, just one.
Go ahead.
That becomes really my starting point to be able to offer any input or thought, because I think that what Public Works may have done or started, it's not even complete, of course, but each one of the respective departments generating that kind of information then allows us to have a better picture of the whole expectation or
Mhm.
desire. And then you can start to say, okay, we can't do all this, but we can consider what that number will look like and factored in over a period of time, so that you're at least starting it to get to that, whether it be up until 35 or some other period in the future.
And that's the kind of suggestions that I want to hear. Thank you, Supervisor, for bringing that up, because that's, you know, it's hard to start a conversation on debt service because we know what we're going to have, and there's too many factors to go into it. But that's the kind of thing that we'd like to hear from the supervisors, so the staff can go and say, you know, we need to replace, you know, chairs in the courthouse, or we need to remodel these courtrooms. How can we do it in a method that doesn't impact I mean, we could go in there and remodel the whole courthouse, you know, for X amount of millions of dollars. But maybe we have to, you know, make it, you know, staggered, or a little bit every year. And then when we're done, maybe we have to start over right where we started. You know, it's kind of how roads work. You know,
And by the way, roads, yes, but so do all these other areas as well,
well, yeah.
because there's some
I
specific
mean,
needs.
it's facilities, right?
Yeah, yeah.
I mean, that's
Anyway, thank you.
Supervisor Rossi. Oh,
If I
go
could
ahead.
just address to Supervisor Horace.
Sure.
The budget does include a 3-year capital plan. It's at the very back of it, and I fully acknowledge that it's not as robust as it could be. The policies that were approved by the FHR committee last week and will be going to county board at the end of August include the expansion to a 5-year capital plan that'll be put in place for the 27 budget. And I also wanted to note to you, Supervisor Osterman, that we do include in the budget a note of like a asterisk or some way of notifying if a project would generate revenue or obtain operational savings. So like if you replace a boiler, we're going to save on energy costs, stuff like that. And that the Public Works Committee reviewed some of the capital projects. I think it was last month in July. It has not changed since then. So the list that you guys received in that meeting is still accurate. It's 22
Right.
and a half million, 23 and a half million,
Right.
something like that.
Thank you, Mr. Chairman.
Supervisor Rossi.
Thank you, Chairman. I'm not sure if everyone's aware, but what they're talking about is in Public Works, we've started with what is a road capital plan. So just looking at, you know, what it started off as, what does a 20-year road plan look like? And what we found out is after the creation of the 20-year plan, which John Rowley and his staff worked on, is that we're so far off of what would be a 20-year plan's maintenance cycle that we can't really just jump into a 20-year plan. So then we fell back to what is a 5-year plan. So the 5-year plan is something that really jumpstarts us and gets us headed towards getting back to a 20-year plan. the first year, I didn't look at that. I was looking at something else right now, but I believe it was $5 to $6 million for year one. I don't think that the ask for this year reflects that, as the plan wasn't completed in time to inform current budget decisions on capital spend for roads. The idea is to continue this on for all the items that fall under the purview of Public Works, Parks and Facilities. So we've got a lot of work to do. But so then the $22 million ask will obviously, that's more than what we look at each year. The debt service itself is, excluding Foxconn, it was 9 million. I'm just looking for confirmation, 9 million, and then 5 million of the property tax is allocated to debt service relief.
It was 9.6 million levied with 5.7 million of sales tax. Next year it'll be 15 million because behavioral health and Marina and 911 and public safety are coming online. So that's gross. That's without sales tax in there so far.
It's without the sales tax. Okay. So some conversations were had, Chairman Kramer was mentioning, there's 15 to 16 million. What I did, and I'd like to see the county do something similar to this so that it's not just someone who doesn't do this for a living, is I'd like to see what is a long-term forecast for our debt service. Can we pull that
The graph?
graph back up, the debt
Sure.
service graph?
Can you put the first graph up? Thank you.
So this shows our current obligations, but what's missing from this is what happens when we keep adding obligations, when we keep taking out bonds. So I always felt that a graph like this is misleading, and not intentionally. It's just it doesn't show that we're going to continue to bond and that we never really get to what is the 2046, which is we get rid of all of our debt. We're going to continue bonding. So this actually continues to grow. And so then, well, what is the level that you can sustain and doesn't overwhelm our levy? And that's where the 15, 16 million came from. One thing about that in this model is it was based off of, current numbers. So we have some reserve usage in the 2026 budget. And so that 15 million growing at 3-4% a year includes $2 million growing at that same percentage. And then also includes $5 million of tax of the sales tax applied to debt service. So we're taking that $5 million that we're knocking off our debt service, and then we're going to continue to apply that. And that's how I got that 15 million works. The problem is then you can't reduce that 5 million that you're taking from the sales tax and applying to debt service. So you have to keep that allocation. And I would like to not be going into reserves, at least on budgets. I know we did better when we did our reconciliations, but it would be a little bit lower if you took off the debt service. It'd be nice to see something come from the finance department on this, where we do have a long-term forecast and what we can accommodate, because what informed my decision is, just taking the current trends and putting it forward.
If I
Go
could,
ahead.
Justin,
Go ahead.
I'm very happy to have our financial advisors here to speak on that specifically. I will note that when they come to deliver the bond sale results, which they do every time we sell, and we're selling tomorrow or we're closing tomorrow. So they'll be here on the September 2nd Finance and Human Resources Committee meeting. They include slides on what the projection is for that. They've built in 15 million because we pay off about 15 million every year. So while I understand what you're saying here, it's more of a flat because you're bonding 15, paying off 15. The biggest portion of it is that these larger capital projects are outside of our normal CIP. And I would like to note that during the 26 budget, that was requested of what our current debt service is. That is available on the website. So the projection going all the way out to 2045, because the newer issuances are not on there. And the policies will include a long-term financial plan in the 27 budget, which was requested by you last year.
Excellent. Moving forward then, with these new buildings coming online, and that's the part that's missing to this puzzle, and then the aquatic center, we've got maintenance coming up, and we will with these new buildings that we've never had before. And that's, some of that can be capitalized, some of it cannot, but some of these items then are going to cut into what would be, we classified as capital, we classified as operational, but it would cut into what would be the operational side.
Mhm.
It's not really, not every repair to a building is capitalized. So that's another component of this that I didn't really look at. But, with new buildings comes maintenance, and new buildings have a lot more maintenance to them. As we found out, I wish Supervisor Wish was here right now. When we talked about the YDCC needing, I think it was a $50,000 or $60,000 controls contract for building automation. Those are that's normal now with these new types of buildings. So it's like your car. The more features you get, the more features you're fixing. So, sorry, back to the start of this. I like the idea of 15 million, but it is a concerning thing that's seeing one committee's 8 departments that fall under Public Works Parks and Facilities. We're asking for 22 million, which is more than the total ask, and that doesn't even get into the sheriff's department. So it's a concerning item.
Supervisor Shakur.
Thank you, Mr. Chairman. Just for clarification, I think I got the idea, but I don't like to think. I like to know what direction I'm going in. Now, we're having conversations in regards to long-term, short-term, short-term, bonding, debt service. Now, are we listening to everybody? Are we listening to the committees? Are we listening to the executive board, committee of the whole, the department heads, the executive budget? Now, the budget is presented by the county executive. So are we talking to give him ideas and concerns so how he'll know how to put his budget together that comes to us ultimately?
That's a big portion why we're having this discussion. To give direction. I mean, I hear people want to legislate. Well, here's the beginning. Have a conversation on where we think we should be or how we should get there. We've never had this discussion. I had Supervisor Wish last time when we talked about levies, said, since I've been on the board, we haven't talked that beforehand. Well, that's kind of a parameter. I mean, the first thing you do with a budget is your net new construction to see where that top number is. In the olden days, you'd go through the list and buy the stuff, and then you'd go up to the top of the number, and then you'd fill it in based on what you were short. I mean, it's not, it was, and since we got levy limits in, it's kind of, you got to work with the top number first and then work your way through. Your capital budget, of course, is handled a little differently, but you still have to understand that, it affects the levy. That answer your question?
Sort of.
Sort of.
You did okay.
Well, I'm trying to get a C plus in the,
Yeah, but
that's kind of,
yeah, you know what I'm saying? See, normally, for some years, we being the county board would wait for the budget to be presented by the county executive. And then we had the budget hearings and all that and go through everything and, present amendments and this and that. We're trying to get into this mix ahead of time. Is that what you're trying?
we had quite a few discussions after the budget was presented. So this is kind of a circumvent, and it's not that we didn't agree. We had a lot of outside pressures, that were in this. I thought this discussion was for everybody to hear and talk about, give some direction. I mean, the county executive may not take it, and he may have good reasons why not to.
Right.
Because he gets to see, he lives at 24/7, and he gets to talk to every one of his directors. We have to, we have to have some faith in that these people are making good decisions, but we also want to set some parameters too.
I can appreciate and understand that, but I like to stay away from for lack of a better word, micromanaging.
No, I don't think this is quite micromanaging.
Well, it could be.
It could be, but
It depends.
depends upon who the county executive
Yes.
is.
Good. Thank you.
Supervisor Weatherston. Oh, County
Just a
Executive.
minute, yeah, just
Yeah.
a second.
Yep.
I just want to clarify this a little bit. I appreciate this discussion, okay? My own gut feeling on this, without doing the deep dive analysis that Supervisor Rossi has done into the numbers, was between 14 and $15 million of bonding. That means we landed at the same place. The priorities are things that I'll have to take a look at and come back to you folks with. But I wanted to have the discussion in advance and not go through what we did last year. So I invite this conversation to take place and listen to the feedback up front to understand what is everybody's feeling, what is everybody's intention about it. I don't look at it as micromanagement. I look at it as advanced feedback, and I think we're probably on the same page with a lot of things, but again, I look forward to hearing your voice on it. Thank you.
Supervisor Weatherston.
Thank you. I'm wondering if, I've been at all levels of government in the state here, and I think it's easy to keep bonding things and forget about what we set up to pay for last year, and so I'm wondering do we carry a running list of projects and the bonding on them, how long the bonding's left? I mean, we have a new building, aquatic center, 911 radios, lakefront work. We got a lot of big subjects going on. Do we carry them all on the books so that we, the board, see them annually?
Yes, prior pages, I think would be even 397, if I'm not mistaken, in the last budget book, would have the list of all the bonds on there. And
And their dates and that kind of
and the dates and the
Right.
maturity dates and the amount. I'm not sure if the payment's in there or not,
Thank you.
but I know there's also a pie graph that shows, of course, those don't tell you what they're for, it's more what series it is and,
Okay.
when we took it out, so,
But as long as there's some data there, so we can fall back and know how much other debt we have to pay off.
yes. There is. Supervisor Horth.
Thank you again, Mr. Chairman. By the way, the summary of those outstanding bond issues is on page 394. Just, we do it. You're close. You're real close.
But I don't have my book with me. I got one page, so.
You did fine. You did fine on that one. But I guess I want to go back to what I had mentioned earlier, that I'd like to give you some informed or educated feedback on a bonding number. But in the absence of what I had shared earlier, it's very difficult for me to be able to do that without having some of this other information that I just talked about. Not that I'm trying to be difficult on it, not because by the way, I think what we're doing makes all the sense in the world, but it's hard for me to be able to weigh in an educated fashion if I don't know. I mean, right now I know PWC is 22 million, and I don't know what the other 6 or 7 departments are, what have you. Just based on what the initial discussions we've had have been. And so that's where, again, I don't know what the numbers would look like. So it's hard for me, and I'm sure Gwen's about to tell me something that I should have known, but I didn't.
No, not of course. If I may clarify, all departments are 23 million. You received all requests at that committee meeting. I can tell you, do you want to know just highway, like what departments do you want to know the breakout for?
I think it would be, you're telling me that all the requests from all the departments have totaled 22 million.
Yes, 23.2 million.
Or 23, okay.
Yep.
I guess my question is then, and maybe Supervisor Rossi, maybe I'm not looking to put you on a spot, but I know when we sat and talked about the Public Works Committee, that night we had that conversation. And again, granted, I know much of that might have been a wish list and a desire, but that was 22 million.
Yeah, it was I ran that report for you for that committee, and it is all capital requests that were put into the budget. I did not break it out by department because some things translate over. You've got some things in land and water conservation, which is kind of a highway or parks thing. So the county executive and I looked at the report together and thought it was fair to just give you the whole thing. So facilities is about 4.2 million. Golf is 300,000, which they have reserves to pay for that. Highway is 14.3 million. Parks was 950,000. And then from there, you've got clerk of courts and cultural and IT, jail, sheriff's office. And all of that together makes that 23 million.
What was the sheriff's department?
The jail is 520,000. That's mostly equipment for like the kitchen and laundry. And the sheriff's is 1.4 million. That's like squad cars and. their
And
normal-
those are true, I'm sorry, may I just ask the question?
Yeah, those are actually all the requests that they came in, so,
That have come in thus far?
yeah.
Okay.
And they're pretty on par with what previous years have been requested.
Fair enough.
Kind of crazy.
So the other thing that I've done, that I've asked Gwen to do, is send those requests back to the departments and have them list their priorities. In other words, from the experts, what do they see in their areas as being the most needy item? Because at the end of the day, I'm gonna have to pick out what the priorities are. And I'm not an expert in every field. I'll be the first to admit that. I might not be an expert in any field, as a matter of fact. So that being said, I've sent them back and asked for them, set your priorities, give me 1, 2, 3, 4, whatever. So when we sit down, when I sit down and take a look at this, I can prioritize this. If you remember last year, there was a discussion about cutting capital expenditures around revolving around some of the cuts. And one of the things on the cutting block was jury chairs of all things. And I asked the question, have you been to the courtroom and looked at the chairs? Are they sitting in lazy boys or are they sitting on milk crates? If we don't know and we don't get feedback from them, I think it's unfair of me and of you to arbitrarily set the priorities without knowing, without feeling and touching what those priorities should be. So just know, initially, that's the December 25th request, $23 million. That's not going to be what comes to this board. It's going to be prioritized. So.
And if I could mention one thing to
Go
your
ahead.
point, Supervisor Weatherston, you wanted to know a breakdown. The budget is really just the outstanding debt service. We do provide a lot more detail in our annual audit report, which is available on the website. I can send the link out. We just published the 2025 audit. Page 39 of it does break it down based on capital improvement projects. That's the annual stuff. Miscellaneous projects, things that we've refunded, the large capital projects. So you can kind of see it broken out by category. And then I also threw in a pie chart. So 34% of our debt is those annual projects. And then 24% so far is those large capital projects.
Supervisor Rossi.
Thank you, Chairman. I'm going to have to go back and look at everything that went in that presentation because I don't remember for the life of me one thing being talked about the sheriff's department as we sat in that room. So if that number was included in there, that got rolled into something that we just didn't see. So that could very much be the case. So I wanted to correct that. The second item then would be, it's what we looked at before. We had a visioning session and roads came up as what I thought was the number one priority. Everyone remembers last year's visioning session, and so I'm hoping this year that roads do get some attention. Obviously, that's an important one for me, and another supervisor who's taken to going on news station and being somewhat attacked for not having roads paved, but that's another story. The last thing is, Gwen, could you point me in the right direction? You mentioned that in the FAQs last year, there was a long-term. Last year is this fog. So if you could help me out, that would be great.
Yeah, it's not the long-term plan, it's the current debt service. So if you go under departments, all boards and committees, FHR, then there's an FAQ link.
Yeah,
And let me just pull it up real quick and tell you what it's called. Outstanding debt as of 12/31/25. So this doesn't include what we've issued in 26, but it does show the principal interest and total debt service for every year going through 2045, including what's funded by levy and what's funded by other revenues, like the chairman said, special assessment.
So and maybe this is, this is your world and I may not always have the proper language, but what I was looking to have from the county is, assuming that let's pretend we issue debt on the same trajectory that we've been for the last 5 years. Does that type of document exist? Because what I did is, again, this is very rudimentary, was just assume new issuance for the next 20 years and what our debt service would look like year over year, continuing to add on the levels that we currently are. Does something like that exist?
It does. Our financial advisors have put something together, and like I said, they'll be at the September 2nd meeting. I'll make sure that they include that in the PowerPoint slide and be able to speak on it.
So it's forthcoming. It doesn't exist right now.
It does currently exist. It's been presented to this body several times in the past. It's a graph. It's not like an Excel file. I can make sure that we get something to you though.
So there's a line, I guess I'm just drawing a blank here. There is a line graph that shows, 20 years of continued debt issuance.
Yeah, and I'm sorry that you guys won't be able to see this. This is existing levy supported by debt, and this is what it will be once we add in other, and if you do a future CIP at 15 million. So they do mark it out by a specific color of existing, the large capital projects, and future, so you can see how it flows through, and this goes through 2046.
Excellent.
If you'd like numbers, I can have them, I know you prefer Excel, I can have them put something together. Otherwise, I'll make sure that they include this slide when they're present before the committee in September.
That'd be great. Thank you.
Yep.
Any other? Supervisor Miller?
Thank you, Mr. Chairman. Few comments. This is really good process. I think, I'm not a mind reader, but I think one of Supervisor Shakur's questions was why are we doing this? And last year there was requests from numerous supervisors about more information and more time to deliberate. So I think doing this now expands the budget discussion, which is good government. And I've said this before, there are counties in the state where the county executive does not even talk to the county board until the day he or she sets down his or her budget. And this is historically, we've had more collaboration, but I think this county executive is doing a significant good faith effort to keep us involved and to come up with a good budget and good solutions for our people. So I think I just want to commend the process.
Yes, and also we kind of expanded it out because of the discussions we had last year. We added 2 weeks to it, so you're gonna, instead of October, you're gonna hear the budget address in September. That moves everything back 2 weeks. So these meetings, the meetings that the staff are having are 2 weeks ahead of time, so we can have a conversation about this, and get more public input, ask more questions, and get, feel better about the process, because I know that's a big process. It's what we do here. So Supervisor Ostman, you got your light on?
Yeah, thank you.
Last comment?
Mr. Chairman, just a quick clarifying question, if I might find, Series 2023A general obligation bonds at 4 to 5.25%, one of the higher interest rates issued for 8.2 million. Amount outstanding is, after 3 years, is 8.2 million. Why is there no movement? Is that a misprint, or why is that? Just
It was structured that way to keep the debt service at a level step, but also I believe that one included short-term things that like squad cars that have a lesser useful life. And so we paid off more at the beginning, take a break, and then resume payments again.
So it's step payments,
Yes.
but so it's been basically just interest payments to this point.
Yes.
Okay, thank you.
County Executive.
So last thing I'll add here, earlier you were talking about what impacts the rating, the AA rating versus Kenosha's AAA rating. And I asked Ramac to do some research on the city of Racine earlier this year and the downtown areas, because I'd like to understand what is going on with that area, because it truly affects the county operations from the bonding standpoint and the economy. In downtown Kenosha, 19% of the people that live in downtown Kenosha make over $150,000. Anybody care to guess what that number is for downtown Racine? Anybody? Less than 3%. That's the economy things that we really have to address somehow. And it's not for this board to address, but that does affect our bond rating overall. So that is, after I listened to PLM last year, there's not a whole lot we can do to effectively move the bond rating up, or for that matter, down, unless we spend like drunken sailors, which you won't let me do and I have no intention of doing. So the biggest factor right now on the impact of the bond rating is the economy in the area. So just thought I'd give that out there to you.
So if there's any other questions? No, just adjourn. Okay, we're adjourned. We're adjourned. Yeah, we need to click it.
To me,
They listen to me.
maybe it was a deliverable or something. On the, I do notice that what I'm talking about is deeper.
Absolutely.
You know,
If we could take our seats. Thank you. All right. All righty. I'm going to call the meeting to order, the Racine County Board meeting for August 10th, 2026. If the clerk could call the roll.
Supervisors Capralian, Spencer, Hoffman, Wish, McReynolds, Preisker, and Wishaw are excused. Everyone else is in the chambers.
And then it's customarily that we have an opening prayer. Supervisor Shakur, would you like to lead us?
Thank you, Mr. Chairman. The name of God, most gracious and merciful, almighty of all things. Ask, dear God, bless proceedings from this county board. We ask that you bless the office of county executive, supervisors, all staff, and all of Racine County, all 200,000 plus, bless them. Be able to work together to enhance and improve the quality of our job. Amen.
Amen. And now the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item number 3 is public comments. Pursuant to section 2-71 of the Racine County Code of Ordinance, each speaker shall be allotted a maximum of 3 minutes. Do we have anybody that wants to, any public? Seeing none, we'll move on to item number 5. UW Extension presentation on a property tax overview. Do we have anybody? Apparently. Okay. We'll have to do that a little bit later if somebody shows up or somebody forgot. Item number 6, reading of the minutes of the previous meeting, which is automatically waived unless requested by a majority of the members present. Seeing no objections. Item number 7, resolutions and ordinances referred to committee.
There are none.
Item number 8, introduction of resolutions and ordinance for first reading and referral.
Ordinance number 2026-41 by Economic Development and Land Use Planning Committee to rezone from A2 General Farming and Residential District 2 to B3 Commercial Service District, Section 22, Town 4 North, Range 20 East, Town of Norway. Owners Ingersoll Development LLC. Ordinance number 2026-42 by Economic Development and Land Use Planning Committee to amend the Town of Norway land use map of the multi-jurisdictional comprehensive plan for Racine County 2035 as it pertains to parcel ID number 010-042-022-004-030. Resolution number 2026-43 by Finance and Human Resources Committee denying the property damage claim of the Village of Elmwood Park. Resolution number 2026-44 by Finance and Human Resources Committee authorizing the appropriation and use of opioid settlement funds to pay 25% of debt service annually for the Series 2026A General Obligation Promissory Notes for the Behavioral Health Building in the years 2027 through 2046, not to exceed $8,467,517. Resolution number 2026-45 by Finance and Human Resources Committee authorizing the implementation of the Mental Health Symposium and transfer of $3,000 from the Opioid Settlement Fund 2026 budget. Resolution number 2026-46 by Finance and Human Resources Committee authorizing the creation of one FTE contracted peer support specialist effective September 30th, 2026 through December 31st, 2027, and transfer of $95,065 from the Opioid Settlement Fund 2026 budget. Resolution number 2026-47 by Finance and Human Resources Committee authorizing the acceptance of the donation from the Watershed Protection Committee of Racine County and transfer of $42,270 within the capital 2026 budget for the Krieger Farm lease site improvements. And resolution number 2026-48 by Finance and Human Resources Committee authorizing and adopting a financial policy manual.
Supervisor Meyer.
Thank you, Mr. Chairman. If there's no objection, we'd like to introduce from Finance and Human Resources Committee, Resolution 2026-43 for first and second reading tonight due to the timing issue.
Seeing no objections. Item number 9, communications and claims.
Number 1, 2027 budget document for the Southeastern Wisconsin Regional Planning Commission.
Item number 1 is referred to the Economic Development and Land Use Planning Committee.
Item number 2 is a notice regarding a claim. Number 3 is a foreclosure of a mortgage, and items number 4 through 19 are notifications from the United States Bankruptcy Court.
So items number 2 through 19 are referred to the Finance and Human Resources Committee and Corporation Council.
Any requests for copies? Supervisor Horth.
Yes, thank you, Mr. Chairman. I'd like to request number 1, please.
Supervisor Osterman. Also 1. Supervisor Miller.
Thank you, Mr. Chairman. 1 and 2.
Supervisor Trotter.
Thank you, Mr. Chairman. Numbers 1 and 2, please.
Supervisor Coleman.
Thank you. 1 and 2.
Any for the vice chair?
1 and 2, please.
And I'll take number 2. Supervisor Shakur.
Thank you. 1, please.
Any other requests? Seeing none, we'll move on. Item number 10, communications from the county executive.
There are none on the agenda.
Item number 11, standing committee reports containing recommendations on items referred.
There are no reports.
Item number 12, second reading resolutions of and ordinances.
Under majority vote, we have resolution number 2026-34 by Finance and Human Resources Committee denying the property damage claim of Veronica Davalos. Resolution number 2026-35 by Finance and Human Resources Committee denying the property damage claim of We Energies. Resolution number 2026-36 by Finance and Human Resources Committee denying the property damage claim of Maria Rodriguez. Resolution number 2026-37 by Finance and Human Resources Committee authorizing a compromise of Racine County's claim against Elena Taylor, Progressive Casualty Insurance Company, and its insured Andre Aguilera. Ordinance number 2026-38 by Economic Development and Land Use Planning Committee to amend the Town of Waterford land use map of the multi-jurisdictional comprehensive plan for Racine County 2035 as it pertains to parcel ID number 016-041-920-010-000. Ordinance number 2026-39 by Economic Development and Land Use Planning Committee to rezone A1 Farmland Preservation District to A2 General Farming and Residential District 2, Section 20, Town 4 North, Range 19 East, Town of Waterford. Applicant Benjamin G. Heimbach. And ordinance number 2026-40 by Economic Development and Land Use Planning Committee to rezone from B3 Commercial Service District to R4 Urban Residential District 1, Section 5, Town 4 North, Range 20 East, Town of Norway. Owners Chad and Jill Passler.
Second.
Motion made and seconded. Supervisor Trotter, you had a question? Oh, okay.
Chairman,
Supervisor Rossi?
might be a point of order, but asking for a core counsel to weigh in on this one. I plan on recusing for 43 or abstaining, whatever the proper language is. But should we take that one up for special or separate consideration, or would just, I see Supervisor Miller nodding yes. So
Supervisor Rossi, that will actually not be taken up with this group. We will do that after the 2/3 majority. And if you would like to be excused, you could actually, sorry, I'm going to stand up so you can see. You can actually leave the chambers while the county board takes the vote on that item, and we will note that in the minutes, so you would not even be present for the meeting for that item.
thank you.
Okay.
Okay, with motions made and seconded, Vice Chairman Meyer.
Thank you, Chairman. So resolution 2026-34, 35, and 36 are claims that we would recommend to deny. And 2026-37 is a claim that we would recommend to settle. As in always in past practices, if there are any questions on these, please reach out to Corporation Counsel.
Supervisor Horth.
Thank you, Mr. Chairman. Ordinance 2026-38 and 2026-39 is for the Highbog Farm properties. The purpose of this was to request to facilitate a future land division and construction of a single-family home. This was reviewed by the committee. Certainly, we had the staff's review of it. Subject property is better suited for a rural residential use rather than a farmland preservation. The proposed land and use amendment rezoning are consistent with the existing development pattern and plans we have for the county. This was approved by the town, and by unanimous vote, we would like to move this forward for approval.
Okay. 2026-40.
We can do that one as well right away. This one is, the owners are Chad and Jill Passler. This applicant has actually requested approval of the rezoning of a property that in fact for multifamily homes. In other words, they're looking to build four single-family residences, which we're pretty pleased about because it also is in keeping with obviously the county's desire to increase availability of housing. This was also approved by the town of Norway back on June the 3rd, and also by unanimous vote, we'd like to move forward with the approval on this as well.
So are there any questions on the rezonings? Seeing none, this is a voice majority vote. We'll take them all at the same time. All in favor, say aye.
Aye.
Opposed? Motion's carried.
Next, we have the items under 2/3 majority vote. That would be resolution number 2026-31 by Finance and Human Resources Committee, authorizing the acceptance of a state and local cybersecurity grant in the amount of $100,000 and transfer funds within the Information Technology Department 2026 budget. Resolution number 2026-32 by Finance and Human Resources Committee, authorizing a new capital project for the purchase of an MTM dump trailer and the transfer of $55,000 within the 2026 Public Works budget. And resolution number 2026-33 by Finance and Human Resources Committee, authorizing the creation of a new capital project for Sanders Campground water upgrade and transfer $150,945 within the 2026 capital budget.
Mr. Chairman.
We have a motion. Is there a second? Motion's been made and seconded. Vice Chairman.
Thank you, Mr. Chairman. So 2026-31 is a acceptance of a grant of $100,000. And this grant would enhance the county's cybersecurity infrastructure and strengthening our critical systems, including AI security. I believe IT Director Andy Shoemaker is here if there's any questions in regards to accepting this grant.
Are there any questions? Supervisor Horth.
Is this a one-time grant scenario, or is this something that we could look towards in the future?
This is the third cycle of multiple grants that the state has. We've won the last two grants. We're currently spending on those grants. Actually, the second one goes through the end of next year, or I'm sorry, August of next year. And then, no, sorry. Check my notes here. Second one ended on June 30th this year. We're reviewing the spend on that. This grant goes through August 1st of 2027. So, but we're this is the third one. So.
Thank you very much.
And there's two more in the cycle, I believe.
There are two more in the cycle now. Okay, that's really what I was wondering.
Any further questions on that?
Mr. Chairman, if
Sure.
I could.
Go ahead.
I just wanted to also commend the member of the staff that actually took the time to walk me through giving in my iPad to give back to get a computer, because extremely well prepared, nice list of things to cover. So for those supervisors that may not have gone through it yet, it's actually a fairly seamless process. And I just wanted to thank the group for doing it.
That's good to hear. I'll share that with my team.
Any further questions on the IT grant? Vice Chairman.
All right, thank you, Mr. Chairman. Resolution 2026-32 is through Public Works for purchase of an MTM dump trailer and transfer $55,000 within the 2026 Public Works budget. This is for what I would call like a riprap trailer. It's 26-foot dump trailer that we can use for materials that the county provides with the roads and scrapping. And it also is another part of the tool that they can use for training their CDL drivers that are learning to get their CDLs, because it's a shorter trailer than a lowboy trailer that they currently use and train on. So it would be an asset to the training of the employees and as well as the adding to our fleet. And I believe Director Beam is here if there's any questions for him on this purchase.
Are there any questions? Anything you want to say, Director? All right. You don't have to know. All right. So, Vice Chairman.
All right. All right, thank you, Mr. Chairman. Resolution 2026-33 is a capital project upgrade for Sanders Campground for water and electric. This will enhance the electrical and water usage for the campground. This is one of our 2 campgrounds that the county owns and operates, and are always looking for ways to improve the services for our campers. And I don't see Chad here tonight to talk about this, who brought it forth to Finance and Human Resources Committee, but Director Beam is here if anybody has any questions on that. It's kind of a combination of projects, from some transfer, some money that there was sitting out there in a paving project that didn't get done and allocated to this, and utilizing that extra money to do the water and the sewer, or water and electric at the same time, is a cost savings advantage for the county. Director Beam? If there's any questions?
Supervisor Trotter?
I think Supervisor Meyer answered my question. I'm just was curious with the transfer of $150,000. So correct me if I'm wrong, but this project was not in the 2026 budget. We're transferring funds from a different account that we did not use funds from.
Correct. We're actually
Okay.
transferring money from a parks paving account. It's a more of a reoccurring account that we have every year. The last 2 years, the parks paving is going to go towards, some of the campground roads, any of the paving, parking lots inside there. We haven't been able to get to those. Highway's been extremely short-staffed and busy the last few years. And so that was one of the accounts that we decided to grab to finish off this project. What's been happening with this project is, every time we go for quotes early on in the season, by the time we go out for bids, the bids come back too high. Well, we can't do it. And then we're basically been chasing this project for a while. And now it come to the point we just really want to get this done. And so that's why we're here.
Great. Thank you very much for the clarification and getting this project done for Sanders Park.
Any further comments or questions? Okay, this is a 2/3 majority vote, so I should clear us up. Every time your phone rings, it scares me because that's my ring. I'm going, oh.
Life insurance.
Okay, that's everybody.
Motion carries unanimously. And then the Supervisor Rossi is excused. And I have noted that for the record. So we will be taking up for the first and second reading. This is a majority vote, resolution number 2026-43 by Finance and Human Resources Committee denying the property damage claim of the Village of Elmwood Park.
Vice Chairman.
Thank you, Mr.
Motion,
No motion. Motion's been made and seconded.
Thank you, Mr. Chairman. This again is something that came before the Finance and Human Resources Committee. And it's based on the information we have, we will recommend a denial of this claim at this time. And if there's any questions, reach out to Corporation Counsel. They'll be happy to speak to you on those items.
Motion's been made and seconded. This is a voice majority vote. All in favor, say aye. Opposed? Motion carried. Item number 13, reconsideration of resolutions and ordinances from previous meetings and or actions on vetoes.
there are no items.
Item number 14, reconsideration of and or notice of intent to reconsider resolutions and ordinances.
There is no notice.
Informational reports.
There are none on tonight's agenda.
Miscellaneous business announcements and oral reports. Supervisor Coleman.
Well, tomorrow is election day for our constituents, so let's exercise our rights and make our voices heard through our votes. Happy election eve.
Supervisor Trotter.
Thank you, Mr. Chairman. I want to give a big thank you to Raleigh and his team. That spring streak from Newman Road to Highway 31 is now complete. And I am excited about it because over the last 8 years, I have received numerous comments about that stretch of road. And Raleigh, thank you so much for getting that accomplished. Thank you.
Any further comments? We are adjourned. Thank you.